What if your biggest struggles were things most people never had to think about? Imagine having strong verbal skills, but constantly struggling to read social cues, understand body language, or even navigate a room without bumping into things. This is the reality for people with nonverbal learning disorder, or NVLD, a neurodevelopmental disorder that affects visuospatial reasoning, social cognition, and motor coordination. Yet, despite its significant impact, NVLD is not officially recognized in the DSM-5, the manual used by doctors and psychologists to diagnose disorders. Difficulties with visuospatial processing, struggles with understanding maps, estimating distances, and motor coordination. Strong verbal abilities. Many individuals with NVLD have excellent vocabulary and verbal reasoning skills. Executive functioning challenges, struggles with organization, flexibility, and problem solving. Social and emotional difficulties, misreading body language, struggling with social cues, and difficulty regulating emotions. Because NVLD is not yet in the DSM-5, healthcare providers don't always recognize it, leading to misdiagnoses and ineffective treatments. This can result in individuals being treated for conditions they don't have, while the real underlying challenges remain unaddressed. One of the biggest struggles for individuals with NVLD is understanding and managing emotions. They often experience difficulty recognizing facial expressions and tone of voice, challenges understanding others' emotions, increased anxiety and distress due to emotional misinterpretation. Since emotions are often conveyed through nonverbal cues, individuals with NVLD may miss important social signals, leading to feelings of confusion and frustration. Research shows that individuals with NVLD experience higher rates of anxiety and depression than those with other learning disabilities. Social challenges are a major hurdle for individuals with NVLD. They may misinterpret social cues, leading to awkward interactions, struggle with making and maintaining friendships, experience social isolation and rejection. But it goes deeper than just struggling with social cues. When social interactions feel unpredictable or confusing, it can create anxiety about engaging with others at all. Over time, this anxiety can lead to avoiding social situations, which results in fewer opportunities to practice social skills, creating a cycle of isolation, sadness, and increased worry. Without intervention, this cycle can reinforce social struggles, making it even harder to form meaningful connections. Dialectical Behavior Therapy, DBT, is traditionally used for emotion regulation disorders, but many of its techniques can benefit individuals with NVLD. Here's how. Mindfulness skills help individuals focus on the present moment and process social interactions more effectively. Emotional regulation strategies teach how to identify and manage strong emotions before they become overwhelming. Interpersonal effectiveness improve social skills and teach assertive, clear communication in relationships. Distress tolerance provide coping strategies for handling stressful or uncomfortable social situations. One of the biggest challenges for individuals with NVLD is that they're often expected to learn social and life skills by osmosis, just picking them up from the world around them. But if you struggle to interpret nonverbal cues, how can you be expected to learn these skills naturally? That's where DBT comes in. Unlike traditional therapy that relies heavily on abstract discussions, DBT teaches skills in a highly structured, concrete way. It breaks down emotional regulation and social interaction into clear, teachable steps, providing individuals with NVLD a framework to learn in a way that makes sense for them. By using DBT-based techniques, individuals with NVLD can better navigate social challenges, reduce anxiety, and develop the tools needed to build stronger relationships. Nonverbal learning disorder presents unique challenges, but with the right support and intervention strategies, individuals with NVLD can thrive. DBT-based approaches offer valuable tools for building emotional resilience, improving social competence, and developing coping mechanisms. The biggest challenge for those with NVLD is getting the right diagnosis and support. Without DSM-5 recognition, many people continue to be misdiagnosed and misunderstood. Raising awareness, advocating for inclusion, and expanding treatment options like DBT are crucial. Want to learn more? Stay informed, support inclusion, and help create a world where every learning style is understood. Subscribe to this channel for more insights on neurodiversity, mental health, and evidence-based interventions.